This is video 2 in a series on controversial opinions I have as an endometriosis dietitian with endo. And in this video, I'm talking about how your labs as somebody with endometriosis can't exactly be interpreted the same way as somebody who doesn't have endometriosis. And despite the fact that we cannot diagnose endometriosis through routine labs, we can look at them and kind of read between the lines to determine what kind of intervention or strategy can be most effective for helping you with managing symptoms. So I can give you 100 examples of this, but I'll just give you a few. So I like to look at labs that give us some helpful information around how the various hallmarks of endometriosis may be affecting you. So for example, I really like looking at a complete blood count with differential. So when you look at all those funky names of immune cells that are hard to pronounce, like eosinophils, basophils, monocytes, neutrophils, I like to look at these. And for example, the basophils specifically, if elevated, can tell me that you may have an issue with histamine excess. And by helping to improve your body's elimination of histamine or identifying where that histamine is coming from, we can get better symptom improvement. Another example would be something like the eosinophils. If the eosinophils are elevated, this might point towards some kind of food or environmental allergen that may also be part of your symptom picture. I also like to look at thyroid antibodies because this tells me whether you may have some autoimmunity against the thyroid, and then we can apply targeted interventions like red light therapy, vitamin D, and or selenium supplementation and gluten removal. And because we know that sluggish thyroid function is associated with more severe forms of endometriosis and more severe symptoms of endometriosis, this can be a quite impactful intervention. When it comes to the hormone hallmark of endometriosis, I like looking at pretty much any hormone, but we know that low testosterone and low DHEA sulfate are associated with increased pain sensitivity. So low levels of these hormones are going to make you more sensitive to pain. I like looking at the progesterone to estrogen ratio because we know that progesterone is an anti-inflammatory, anti-proliferative hormone. And so if there's room to improve this, I very often will see some pretty significant and drastic changes in pain levels. I also like looking at prolactin. Prolactin can suppress LH, preventing ovulation from happening. If the levels aren't high enough to do this, at the very least, they can affect your anti-inflammatory, anti-proliferative progesterone production on the other side of ovulation, and that will have some pretty significant implications for pain. Okay, the last example I'll give you is on the nervous system front. I love looking at sodium and potassium because these give me a lot of information about how your adrenals are functioning. Potassium has sort of an interesting relationship with cortisol. When your cortisol is elevated, it will kick potassium out in the urine, and in severe cases, we'll see this reflected in blood work as a very low potassium.